Great. Thank you very much. It's my distinct pleasure to have this opportunity to be here. What a wonderful conference, and I really want to thank Mr. Black. I want to thank Mark for inviting me to be here. I would have loved to be here just to be a fly on the wall, just to listen to the conversation. So we had a wonderful discussion this morning, and Ron, of course, gave an exciting, a really tremendous, heartfelt presentation. Just a bit of a history. Ron actually recruited me to Vancouver General Hospital, so he's been my mentor. And the other thing, you now have witnessed the fact that that's the reason why when I invited him to our provincial emergency conference, he was the only one ever in that conference to receive a rating of 11 out of 10. From amazing. So you witnessed it now. I'm also very glad that I follow Ron for another very important reason. I think this morning we have talked a lot about the health system, focusing on how do we look at times of austerity. I think Richard did a fantastic job setting that scene. And our panelists talking about the importance of how do we balance the system to deliver the type of quality care that we need with the economy that we need to achieve. I think Ron started to help us to bring it down to the co-phase level in looking at disasters and the patients. So I think I'm going to approach this presentation looking at digital technology first and foremost from a patient's point of view. To look at that particular view, to get a sense about how digital technology really is revolutionizing how healthcare is delivered. And I hope to be able to deliver that personal impacts, how technology is affecting us. I'm going to wrap up a little bit with a few questions that actually throw back to this particular group together for us to explore together. I don't have all the answers, far from it. But I can present to you a bit of a digital picture of where we are today, and then we can go from there. I don't know the Vancouver Board of Trade membership. In fact, Ron and I was talking about, is there any way by giving a speech here I can get a free membership for a year? Love to do that. So, Mr. Black, can I do that? I got an okay there. One of the things in academics is we always try to disclose things, and that's why I want to do this disclosure. I'll be talking a lot of products in this presentation, but there's no financial ties in my unit as EL Strategy Office to any of these products. We do receive grants and foundation funding for research in biosensors. I receive funding research for social media research and engaging in healthcare. We also receive government funding. For example, Ministry of Health has funded us in looking at intercultural online health network. How do we use technology to engage our multicultural population in British Columbia? We also receive funding, for example, TELUS has been fantastic. 2 years ago, funded us on a e-health summer camp of students, high school students, and I'll tell you a little bit about that story. And we'll be having a conference coming up in May 2014 where we do have sponsors in that conference. Again, Cisco and TELUS has been our platinum sponsor and Cerner as our gold sponsor. I want to make these disclosures to you so that you understand the context of what I'm going to present to you. And I welcome you to ask further questions if you have any questions. I think finally, I'd like to just one more thank you for engaging us in this conversation, us meeting the faculty of medicine at University of British Columbia. Very fortunate for us that we are the medical school in this province, and under the leadership of Dr. Stewart, that we are looking at not only the education, not only the research, but how can education research look at social accountability, look at how we can contribute to the health system. So thank you for having faculty of medicine here in this area. Let me ask you a few personal questions. What would you do? What would you do if you, at some point, have your genes decoded and find that one of your genes suggests that you have a 90% chance of developing cancer? What would you do? Well, we know what Angelina Jolie did. Her mother has breast cancer, and she went and had her gene decoded, and she did have the BRCA variation gene mutation, and that suggests a 90% chance of breast cancer. That's what she chose before being ill, to have double mastectomy. That's what she chose. What would you do if one day you suddenly have irregular heart rhythm, and again, you're curious, you went and get your genes decoded, and you have a variation that in fact you may inherit the condition of atrial fibrillation, which is a fluttering of your heart that may put you at risk downstream for stroke. What would you do if you say, well, okay, how can I figure out how often do I get this irregular heart rhythm. At this point in Canada, in British Columbia, and not just exclusive in Canada, in many jurisdictions, you can get a Holter monitor, put it on your chest for about 48 hours, hard to carry it around, and that's about all that we have at this time in health systems to support you. What if you know that in US, now there's a system where on your mobile phone, you can slap this case at the back, and at any time you want, you can put it on your chest and actually monitor your heart rate anytime, 24/7, if you choose to. What if you have that system at this time only available in US, not available in Canada? What would you choose to do? If you have been diagnosed with a medical problem and you have a medication for a certain illness that on the internet you search and you found it's not controversial, but it's clearly useful, but currently not offered in your community, what would you choose to do? I think more and more we'll be faced with many of these choices. And again, on one hand, on the health system, absolutely, there are issues we need to struggle with, there are austerities we need to face, there are economies that we need to face. But when it comes down to it, technology will put us into these contexts for us to consider. And what would we choose as a community? What would we choose as civil society? What would we choose as stakeholders of the health system? This is old data now. 2010, more than 6 out of 10 Americans look up on the internet for health information about themselves. Follow-up study, 8 out of 10 Americans look for information on the internet. Again, old statistics in Health Canada, last time we did any survey, 2010, 6 out of 10 individuals look up their health information. In fact, when I do my emergency department, for those who don't come in unexpected, well, most of them don't come in unexpectedly, but they don't come in critical, for example, car accident, I can assume that they have looked up information on the internet before they come in. In fact, very often, because of looking up information, they come in for the reason to have that. And that's fine. And that's absolutely fine, because we want to make sure in the emergency department, as Ron said, to make sure that those that need the service will be there. And many times we don't do interventions, we don't prescribe. But what we do is to reassure and to say, well, in your case, even though you have fever, headache, stiff neck, and you have spots on your body, you don't have meningitis. And so we give those kind of perspective. And in fact, when we discharge patients, if they haven't looked up for the information, I'll actually give them, well, here's the term. You passed out because you have a vasovagal syndrome. Here's how you spell it. And here's a website you want to check out. You want to look more so that you can participate in understanding your disease. And so that has been part of the routine of using technology to support our patients. What I'd like to explore with you in the next 30 minutes or so is, number one, what does patient-centered e-health look like? What are some of the current opportunities there? What are some of the leading e-patients right now are leveraging and using the system to achieve the best of care? What are some of the opportunities there? What are some of the ways that we are now using it? What are some of the ways that these uses will definitely influence how our health system change? And now I'm going to leave you with some questions that we will explore either in the question period right after. I'd love to hear your thoughts. And also at the panel that we explore together, because I don't have all the answers. But I think these are questions that we need to answer as stakeholders. A lot of discussion about patients as partners. Early on, Thomas made a great case about why we need to do patient engagement. And there's a lot of discussion about patient-centered care. In fact, the fact that we as health professionals, we as patients, having health professionals working with us in different expertise to put together and to look at a system is very good. But the issue that Thomas raised, and the very important one, is, are we actively engaging them? Are we looking at a passive system, or are we actively trying to engage our patients? In fact, Institute of Medicine did a good definition of patient-centered care. It's about providing care that's respectful and responsive to individual patient preference, needs, and values, and ensure the patient's value guide all the clinical decisions. Very great definition, very sound definition, but I think it lacks that active tone. What if the patient is not only receiving care, what if he or she is actively want to get engaged? And why is that the case? It's funny, my daughter, I have 2 kids, 20-year-old son, 18-year-old daughter. When my daughter was 15 years old, that's when iPad came out. And so half a year after iPad came out, one day she came home shocked. She was shocked. I said, what's wrong? What's wrong? And she said, I couldn't believe it. On the bus, I saw a father gave the iPad to his 2-year-old toddler, and the 2-year-old toddler was just playing with the iPad like he's been using all his life. He was shocked. I was very fortunate. I was the associate dean at the University Faculty of Medicine in 1998 when I first started. And in fact, that's when the internet started to become popular. And so I got really excited. I still remember the excitement of looking up an academic article, and it was published online 1 week before it was actually printed. At that time also, the poster child was the grandparents, to be able to go online and then find the information. And you see Vancouver Sun headline, wow, grandparents find information on the internet. Today, the technology has become so ubiquitous, so easy to use, that both extremes of ages become those poster children to show how technology can be very helpful to us. In fact, none of us in this room, I think, would think about traveling without using the internet, to find information or banking. Yet, we don't do that in healthcare. My son one day asked me and said, geez, how come I can't select an appointment with my doctors, with my nurse, in my clinic online so that I can pick a time that I can be there? How come we don't do that? It's a complicated answer. I kind of know the answer. I kind of understand the background of the answer, but I have no words to answer to say why to him, to his generation, to my daughter's generation, to our own generation. What are some of the opportunities of technology that offers us? I'd like to offer you kind of 4 areas to think about. One, it's about using technology to deliver health services, or commonly known as telehealth. So how to use technology to deliver health, and also using sensors to help us to understand and help the patient. Many of you in the healthcare industry may already know many of these, so if you do, tolerate that with me. I remember I got involved in telehealth in 2003 in British Columbia, and we were able to actually implement some of the technology in emergency department. This is my colleague, Dr. Swimfer, in Vancouver General Hospital. And there was a case in Prince George where there was a multiple trauma. There was a patient who had a bleeding, a blood clot in the brain. And the general surgeon there received Dr. Swimfer's direction to do a burr hole surgery through technology to assist him in doing that surgery. That was then. You have these type of equipment. You'd need the same equipment over at the other side and to be able to do that. But now today, we have very easily used in your pocket. You must have done FaceTime. You must have done Skype. And these opportunities are there. In fact, there are companies, private companies in British Columbia and in fact many places to do technology, using technology to see patients, to see doctors, to see health professionals. Also, my colleague, Dr. Pavlovich, who's a faculty member who actually used to work full-time in Takla, in one of the First Nations communities in the north. Now he's moved to Abbotsford, yet he still goes back to Takla a few days over a month period of time to actually see patients. When he's there, he'll use telehealth and put that probe into the ear and show the eardrum and to be able to show other people. Recently, he was using an ultrasound on a pregnant lady, do an ultrasound on that patient, and be able to send the ultrasound away. But when he leaves the community, he continued with the relationship through technology to maintain relationship with a nurse practitioner in Takla to continue to deliver services, just like what he's doing here. In addition to actually using technology to see patients, we now have technology that are very portable. So this technology developed in Seattle by this company using ultrasound probe. This is about 4 years old. Ultrasound probe plug into my tablet device, smartphone device, and that becomes an ultrasound machine. Then we can now do ultrasound and see the patient and see whatever we see, but you can now send the image anywhere you want with this type of technology. Think about this not only in Vancouver, not only in the Canada context, but in those communities that are underserved. Our rural communities in Canada, internationally, in global areas, these type of technologies are there. 4 years ago, it was there. Here's a continuous blood glucose monitoring device. It's not cheap, but that device, with that little bubble, stick it on your skin, you can now monitor glucose continuously for anywhere from 6 hours to 24 hours, depending on that bubble. And so for those diabetic patients who said they just started diabetes, For example, seeing my colleague Marshall here with diabetes, they have the ability in the first while to adjust their insulin so that they can get it accurate. And also, during the time when they're sick, when their glucose fluctuates tremendously, they can use this now to monitor that particular period so that they can use insulin better, and so that they don't get into hypoglycemic or hyperglycemic episodes, so that they can come to the emergency department and see me. Here's a device done by Netra, that little rectangle piece that fits onto your iPhone camera. And this won the Nokia Foundation Award in 2012, a low-cost device where you look into that lens and it'll give you a prescription of your glasses, what you need. Isn't that wild? If you go to TED Talk, you'll hear this guy, look up Netra, TED Talk, you'll get that information. And again, if you think about it, it may not be as relevant for us in Vancouver, but for those areas that they don't have optometrists, be it an underserved community, be it a rural community, if you have a set of glasses, you are able to actually restore sight on those people in a timely manner. So it's a cheap thing, it's a little thing, but it's a huge thing for people who can see. In fact, every morning I wake up, I have to search for my glasses. I know how it looks like, right? Not being able to see. And so this, again, completely wild. So this device just started last year as an app. It's a pure native app on your mobile devices. Don't need to add anything else. How many of you know people with asthma? So when you have asthma, the person needs to test how fast the airway flow. So you kind of blow into a machine with a tube. You measure the speed of air coming out your lungs as a severity index of asthma. What this does is it doesn't need that tube anymore. You only need to blow in the microphone, and the microphone detects the speed, and it gives you the asthma, the speed of flow of that air. Again, amazing technology everywhere. And this is a recent announcement in SFU, just in our own community, looking at portable brain scan. By putting electrodes around the head, by mapping it out and do a 3D reconstruction, you can diagnose concussion in the field. You don't need to come into emergency department and get that. These are the type of technology that I keep pushing towards us now. This is a selection of oximeter, so you can put on your finger and detect how much oxygen you have in your blood. So you have a selection of them with different prices that you can use today if you want to go get it. It's there. Also, if your hospital, if your clinic use a certain types of devices, with this app, with that company, you can link all the device signals into your mobile phone, and you can actually track all the different kinds of parameters of that patient. And so I no longer need to be in an ICU setting with my patient in presence, looking at the patient. I have all these technologies available for me, not only to see the patient through technology, but to actually detect the patient's biosensors as we move forward. These are incredible opportunities for us. And so this is a funny video of a mother doing the ultrasound. It may not be that far away when in the emergency department, I may have a mother who comes in and said, I'm 7 months pregnant. Usually my baby, I didn't look at sex, but usually my baby, heart rate's around 130, 150. But for today, for some reason, the baby moved less, heart rates go down 120. And then I was curious, I measured the circumference of the head of the baby. It seems to be 1 standard deviation smaller than quote in literature for 7-month-old. What does that mean, doctor? It's funny, but we may not be that far away. Is our health system ready for it? Is us health professionals ready for this activated patient who's very keenly interested in his or her care? Can we, as a health system, get ready for it? Second area, social media, huge area of growth. Social media, it's not only about Twitter, not only about Facebook. In fact, my kid says Facebook, Twitter, passé. I'm escaping from it, going somewhere else, right? Instagram, take a photo, you get a sense, take a caption, a Vine, a 6-second video. Social media is a collection of socio-technical approaches for people to connect, to support, and to learn from each other. In fact, the Pigeonhole today, the technology, is in some way a mini social media for us as a private group for us to have that conversation. And you see the power of it. You see not only that the questions are being asked, that we respond, the way that we vote, but really we can see all the questions of what people are interested in asking. You may have been aware of groups like Patients Like Me going on for about 15 years now. And recently, Institute of Medicine has just did a study with them to try to understand what activated patient is like when they participate in these. They are patients who may have similar disease like diabetes. They get together and said, geez, I want to talk about, let's share some tips on how do we manage each other. They do research together. For example, a similar group, Cure Together, they asked 106 patients with chronic fatigue syndrome, what works for you? What helps you with chronic fatigue syndrome? And so they plotted it on a graph. We look at it, frequent short breaks, rest on the your top right-hand side are both popular and effective. Fantastic. Surprisingly, exercise, very popular, but not that effective in this particular group. But when we look at the left upper quadrant, wow, low-dose naltrexone seemed to be, for this group, not that popular, but quite effective. Now, I'm not a specialist in chronic disease in chronic fatigue syndrome, so I really can't tell you. In fact, if the patient comes and said, I need a prescription for low-dose naltrexone in the emergency department because today I feel particularly weak, I wouldn't be able to tell that. I'd talk to my colleague, I'll look up the information myself. But I would suggest to you that, in fact, this is happening now without us in the health professionals knowing about this officially, without us in the health system knowing about it officially. And I would further suggest to you that if we ignore this information, it'll be at our peril as health professionals, not being able to provide the type of care that we need. If we don't understand our patients to say, these are the type of information they have, if it's accurate, we have found low-dose naltrexone to be useful, let's use it more. If that's to be false, we should say, well, geez, maybe you shouldn't do this. We can poo-poo this and say, well, actually, it's not scientific, this chronic fatigue syndrome, they have other disorders. But again, this information is important for us to gain the type of insight that we can then apply evidence-based medicine. How many of you heard about Quantify Self or member of Quantify Self? I see one hand. So this is a group that over the last 5 years has been looking at helping each other. It's an international group. There's a Vancouver club. It's an online group. Helping each other to measure ourselves, to quantify our health. Here's an example on the website, someone tracking the caloric intake. Looking at this graph, I have two guesses. One is probably a male, and second, he is probably trying to lose weight. The reason I said that is usually we look at the graph, on average, the blue is the morning caloric intake, the red is noon, the green is evening caloric intake. So it averaged out about 2,500 calories. Usually for male average size, it's anywhere from 1,600 to 2,000 calories for us to maintain our weight. For female, it's a little bit lower, 1,200, 1,600 calories per day, depending on exercise. And so this person is above that. And number two is he said two things. My behavior is predictable. I lack discipline on the weekend. And we look at the peaks. They hit 3,000. They all fall on the weekends. Watching game, eating chips, watching Canadian hockey maybe. And then you can see the valley right afterward. A particularly bad one, it drops down 1,000. You know what is 1,000 calorie? Our lunch is probably 1,000 calorie when you take each the dessert. And if you eat a hamburger with onion rings, that's 1,050 calories. So this person on Mondays survived on one burger and onion ring equivalent. But this is important in the sense that this patient, we can say patient-centered care. Yeah, you may need to lose some weight, do exercise 30 minutes every day. But for this patient, what he needs advice is, how do I control my behavior in the weekend? And if we as health professionals don't know that, it's to our fault that we're not helping him. And in fact, this patient's now activated. This patient's prepared to act on it. How do we activate this patient, work with him, and calibrate his weights together? We've done a literature review on text messaging. In fact, this is a list of text messaging which has randomized controlled trials on clinical studies. These are very strong evidence that this is helpful. We have randomized controlled trials that all these text messaging will be helpful. For example, adherence to medications. When you take medication, a reminder for it. Smoking cessation, remember you to stop smoking. Management of different kind of diseases. The device in your pocket is already a very effective health tool that has been proven to be useful. Are we using it? This is a combination of a few studies, the Canadian Telecommunication Wireless Association, Google, and also Rogers Communication. We found that in 2013, there are more than 8 out of 10 Canadians have a cell phone. About half of them have smartphones. How many of you in the audience have a smartphone? Wow, wonderful. Much more than the average here. So you have the device here for your health. In fact, let me validate for you, 78%, 3 out of 4 people use it for social media. Well, today we have already experienced it here. 3 out of 4 look at videos. I bet, how many of you watch the Olympics on your smartphones? Okay, some hands there, wonderful. And also, let me vote on this one for you, just a brief vote. Average of 30 apps, not health, but apps, about 30 apps in the mobile phones. How many of you have 30 apps? Think back numbers that you've downloaded. So actually quite a lot of hands here, about a quarter, in fact, in this group. How many of you have 10 apps? Yeah, this changed my practice. When I come to the emergency department, not only do I assume now that they have looked up the information, but if I see that they have a mobile phone device, I'll actually ask them, do you use that for your health? In fact, when appropriate, I'll show you some examples. I should recommend apps to them because they're starting to use those apps, starting to use the phone as a very personal device for their health. And we need to take advantage of that to actually stimulate that. And in fact, mobile health apps, this is about 2 months ago now, they said about 43,000. I'm sure that numbers continue to increase and escalate. Currently, about 4 areas where people look at in terms of mobile health that have been proven quite effective. Diet, you saw in that caloric intake piece. Exercise, how to monitor the exercise. Mood, psychological wellness. A lot of apps there. And also some ways of measuring physiology. You may know some of these apps. In fact, that person who was tracking calories, this is one of those apps, free apps, MyFitnessPal. You can download it. Again, if I'm boring, please pull out your phone and do your text messages. If you're interested, pull out your mobile phone and download this on your app store right now. It's free. MyFitnessPal. It tracks your calories. In fact, so it's not too laborious. In fact, it has actually Chinese recipe. A bowl of rice is 100 calories, I found out. Wonderful. And so I download that. And because of this app tracking my own diet, last year I lost 13 pounds. It's incredible. That's in a healthy way. Not a crash diet. Here's a free pedometer. But before you get any electronic device, go to the App Store, check it out, see if it's there. Because if it's there, you don't need to buy it. Like a pedometer. There are a lot of free pedometers here. This one not only measures your steps, it actually do GPS if you allow it, so it tracks your distance that you walk. So not only do you track number of steps, but how far you walk it. Here's one of many where they track your mood. So, are you feeling great? Are you feeling bad? Are you feeling anxious, depressed? The way I use it in the emergency department is many patients come in the emergency department feeling sometimes anxious, sometimes depressed. Sometimes they know about it. Sometimes when I ask them, what makes you depressed? What makes you anxious? They say, I don't know. And so when I discharge them, one of the things I said is, well, you may want to think about it. You may want to use an app to track. Whenever you start feeling a little bit anxious, start feeling a little bit depressed, pull it out, track that moment, and just write down what you're thinking. That may or may not help you downstream, but it gives you some more insight. Just as in caloric counter on that other patient, he tracked the fact that it's every weekend that he had problems. And so apps like these help individuals to say, well, I don't spend 24/7 with you, but you can use these to start helping yourself to understand, to be activated, to participate. Here's a free heart rate monitor. In fact, again, free download onto your smartphone, and it turns on a little light, and you put your finger on the light, it'll detect your pulse. And so it gives you, within about 10 seconds, count your pulse. So again, for those patients who come to the emergency department with palpitations, by the time they come in, they have regular heart rhythm, I may suggest them, you may want to try downloading this, test it with your finger, and then see if, in fact, there's irregular rhythm. And if you do, bring that to your doctor so that we can see what the pattern's like. So when you have palpitation, are you going really fast or are you going irregular? In my case, 2 years ago, it was going irregular. In fact, I had a condition called bigeminy. At that point, I decided, well, I got to cut down my number of coffee use. And so now I'm cut down to like 4 cups of coffee a week. My bigeminy went away. I'd become an activated patient because of these. I always believe in every presentation, hopefully you take home at least one thing. And again, I know there may be many things I've already put you to sleep, but this is one thing I'd like you to take home if you're interested. It's a sleep alarm. How many of you have this, sleep time? Okay, so you may want to check this out. So again, free. You can download it right now. And what it does is you can set your alarm. So in this case, it's set at 6:30. And after you set it, what you do is you put it onto next to your pillow, and you go to sleep. And what it does is track your movement when you're sleeping. So when you're awake, you're kind of tossing, turning. That's the orange. So they detect the motion. And when you're in light sleep, you're moving less. That's green. And then when you are dreaming, only your eyes move, but your body doesn't move. And so it's the blue. So in this case, I slept a good number of hours. I have 74% sleep efficiency, and I have 2 dreams, one long one and one short one. So what this does was really helpful. Recently, there's a lot of literature now coming out about the importance of sleep. And we always said, you need to have 7 to 9 hours of sleep to really feel replenished in the morning time. Many people I talked to already said, well, yeah, it's 7 to 9, but for me, 6 hours is actually enough. And they could well be right, because it's about sleep efficiency, isn't it? I can go to bed and wake up, but I can be tossing and turning there. But it's a sleep efficiency. I find that if my sleep efficiency is less than 60%, I don't wake up feeling refreshed. But if I have a good 90% sleep efficiency, it doesn't matter if I'm only there for 6 hours, I get a good rest. So it gives me insight in terms of how my sleep hygiene is. But the most important thing, the thing that I like the most about this alarm is this. That when I set it at 6:30, at 6 o'clock, it'll start detecting whether I'm in deep sleep or not. If by 6:15 I'm not, it'll start bleeping a little bit of sound to get me into light sleep. And then the alarm goes off 6:30, wake me up. Any of you have been waking up in the middle of the night, in the middle of your dream, a really good dream, you got to wake up, you go, no, I want to go back to my dream, right? And you don't feel refreshed, but this gives you that refreshing sense. Wearable technology. Huge, huge this year, about Google Glasses, about putting sensors all over your body to track every single motion, to look at fabric, smart fabric, so you can put on your clothes and monitor how you do. So today it may be your smartphone. Tomorrow it may be your jacket, outpatient gown in the emergent department, where you can track, and you look at sleeve, you get all the things, and then answer a phone with your sleeve. January 2014, Google talked about contact lenses to start looking at detection. I'm very fortunate to be working with some engineering colleagues at UBC. Our engineering colleagues recently got a grant to actually look at wearable devices that can be put on your body for a long time so that you don't have to keep peeling it off, take it off. So these progresses will happen, and the social media will be that tracking. I know I'm running out of time, so I'm going to speak a little bit quicker onto electronic medical record and genomics. Looking at electronic records, our province, our health authority, working very hard and effectively starting to put together electronic health record system. There are many challenges there, but they're working very, very strongly towards aligning the data system together. And also our medical doctors with the BC government working with BC Medical Association, now Doctors of BC, through the PITO office, now get up to almost 90% now. I just got a refresh rate today. Almost 90% of physicians in province of British Columbia with electronic medical record. Tremendous to have that capturing of that information. And the private-public partnership in making available the patient data so that they can now sign up for eHealth portal. How many of you are on eHealth portal to sign up? Wonderful, a lot of hands going up. In fact, I start now in my shift in the emergency department, every 2 shifts, I'll have one patient come in and said, I have this problem. Here's my lab that actually I download. And for me to be able to discuss that with them. Tremendous opportunity for capturing the data of today. But let me suggest to you that not only can we track data of today, for example, the map of Canada in terms of hepatitis C, you can see the distribution. But with the genomic population, the ways that we can start looking at our gene, the way that disease are manifested, we're now starting to have the ability with the electronic record, coupling with genomics to understand what environmental causes can cause disease, what are some of the genetic background that can lead us to be vulnerable to those diseases. Even back in 10 years ago about genome projects, the milestone they want to hit is $1,000 genome. If we can decode a gene, $1,000, that was the milestone. We actually achieved it when I was in UK in January 2012, $1,000 genome. We are there. In fact, now there are services online that measure certain parts of your gene exomes, certain parts that most of the variations that we know of now. In fact, the price was dropped to $99 by 23andMe. You swap your mouth and send it in. They will decode some of those genes for you. And with that, they suggest they can diagnose 40+ inheritable conditions. One of them, very useful, it's about Coumadin sensitivity. So many times we put people on blood thinners, and then we know that some people are extremely sensitive to that. In fact, there's a gene locus to pick out some of those patients. We don't use it today in the health system. But when we start doing genome tracking of our patients, we will get there. Now, this service suspended because FDA alerted them that they're not authorized to do this, and so they're not available right now. And that's an issue, but I think accuracy of the issue will be very important, but it will come. One day, all of us will have genome decoded onto our mobile phones. How do we as health professional, health system, deal with that tsunami of this type of information? Discussion about electronic health record, marrying with your genomic data so that we can continue to track it, so that for those who have a pneumonia that admitted today, but for some reason every year at 6 months they regularly have pneumonia, we have now ability to retrack them and say, how come they're vulnerable to that? And so, ladies and gentlemen, thinking about patient-centered care, think about e-patients, these 4 areas, telehealth, social media, electronic record, genomics, are going to be the propeller of how do we advance about patient-centered care. Again, definition of patient-centered care, a definition of e-patient is a health consumer who participates fully in his or her medical care, and they see themselves as equal partners with their doctors or health professionals in healthcare processes. These are really 2 sides of the same coin about the fact, how do we partner with our patients? How do we support them? How do we truly help them when they are activated? How do we help them to move forward? And so in my final 2 minutes, I'm going to throw a few questions for you, for us to consider. There's no question in e-health that we need to work together. Health professionals, health system, got to be there to set some activities, innovations. But we need the policymakers, we need the health administrators, we need the industry to put the technology in place. I don't invent iPads, but how do we look at the innovative use of technology together? We all need to be there to bring the best of e-health forward for our patients. But there are issues, and these are the issues I'd love to discuss with you during the panel or receive your questions. We have a dialogue together. What about e-health equity? Wi-Fi, sorry, that was kind of fun. For those patients who may not have connectivity, for those patients who may not be able to have a mobile phone, for those patients who may have those technology but don't have the literacy to use it, I don't mean in a negative way, but to be able to engage and support our patients to achieve that e-health literacy so that they can take advantage of this will be important. How do we do that? When I was trained in medical school, I wasn't taught these skills: telehealth, mobile health, patient-centered engagement, electronic health record, personalized medicine for surveillance. How do we get our health professionals the capacity that's needed to look at the wave of technology coming? From a health system point of view, the 4 areas around towards improved health outcome, vitally important. The innovation, the green one, no question, we need to partner with our industry together for that innovation. But the innovation need to be judicious, need to be applied, need to be hand in hand with our health system so that it can become a very effective way of looking at it. Here's a question. Industry do come in, they have a huge place for this, they need to be there. But how do we support commercialization? How do we accept the facts that companies need to, part of what they do, commercialize? And how do we support that? Can we have that discussion about the fact that how do we do ethical profit making, not gouging, but how do we support that so that the industry have the ability to sustain? And in fact, in a larger system, in that pay system, how do we leverage that together for a sustainable healthcare system? We started to touch on it this morning, love to delve into it more. And how do we look at a system that's satisfying to all of us, not only putting our health system hat, not only putting our health professional hat, but put on our individual hat, person hat, family caregiver hat, that we be satisfied to help look at that health outcome. And finally, how do we look at the interface between individual and system, so that when we look at these areas of patients, health professionals, policymakers, health administrator, industry, that we can manage our expectations together, understanding that we are in this moment of change. How do we work together? How do we understand the need for privacy for our patients, but also need for aggregate data to guide our health system to use our resources appropriately? Profit pay, we talked a little bit about how do we build the capacity, how do we change the workflow so that me as a health professional said, I've always seen patients this way, I'm not going to change the way I'm going to practice. How do we help those changes and move those changes forward? How do we work together? As a faculty of medicine, we're very fortunate in being looking at part of the system. Again, I want to thank my dean for the establishment of the eHealth Strategy Office. On the patient front, we have public health sites to help patients look at 2-minute videos on how to use apps. So we have a site on that. Also, for those who are interested, using how do you start social media. If you haven't started, how do you start social media for your health? We also implement eHealth into our curriculum, Renew Now, so that for our medical students, they'll receive type of training. We work across the country, across medicine, residency, and interprofessional to look at how do we inject eHealth training into education. The May conference coming up, 2014, we're establishing an eHealth conference for health professionals. I'm sure many of you have been to some eHealth conferences, fantastic conference, very necessary. But very often, not enough health professionals show up for those conferences. We in British Columbia need our health professionals to work together with health policymakers to advance eHealth. They need to understand where we're going together. And so this conference is looking at engaging our health professionals together. I'm going to leave you with this thought. No one can whistle a symphony. It takes an orchestra to play it. And the reason an orchestra plays beautiful music is because they practice, as Ron said, and they work together. They're all different, but they work together. How do we, as system stakeholders, work together so that we can enable eHealth, so that we can look at using eHealth to improve health services? Ladies and gentlemen, we are in a defining moment in our health system. Richard mentioned about the fact that we're in this austerity, this change. Yet technology offers the opportunity now to look at some of the ways that we can innovate. I hope never healthcare would go away from high touch, because that's vitally important. It's a relationship that builds a relationship with our patients. That's support. But this is the defining moment, so let's figure out how do we also do high tech, so that with high touch, with high tech, we not only improve the quality of service that we can provide, but provide us with the best province where we live, with a health system that's sustainable, with our patients, our population feels supported in health. Thank you very much for your attention.